Okay, so in this video we're going to talk about the corticobulbar tract involving muscles below the eye. Two specific cranial nerve that we're going to talk about in this video are cranial number 7 that is associated with facial nucleus, and cranial number 12 hypoglossal that is associated with its respective nucleus hypoglossal. So the signal it's going to start in your primary motor cortex, specifically the lateral part of it. First, we're going to talk about the facial nerve. So the signal is going to start here, and it's going to the opposite side, and it's going to synapse with facial nucleus. So let's say that this is the right side and the left side. This is the anatomical position. So the signal started on the left side of the primary motor cortex, but it's going to synapse on the right facial nucleus. And then the facial nucleus, it's going to send its signal and synapse or innervate, that would be the better word, and innervate the skeletal muscles on the right side, below the eye. So if somebody has asymmetry in their face below the eye, let's say on the right cheek, then you would suspect that the damage could either be in the facial nucleus on the same side, so on the right side, or the damage could be in the primary motor cortex on the contralateral side, which in this case would be the left side. Now I'm going to draw the hypoglossal innervation of the tongue. So the signal is going to start on, in this case, on the right primary motor cortex, and it's going to decussate and it's going to synapse with the hypoglossal nucleus. And then the hypoglossal nucleus will send its signal and innervate the tongue. Okay, so let's say. And two things can happen in this case. So if the damage here is below the hypoglossal nucleus, the tongue will deviate. If the tongue will deviate to the same side as where the damage is. So if the tongue deviates to the right side and the damage is below the hypoglossal nucleus, then you can suspect that there is a damage in the hypoglossal nerve on the right side. Or if it deviates to the left side and the damage is below the hypoglossal nucleus, you can suspect that the damage is in the left hypoglossal nerve. However, if the damage is in the upper motor neuron and above the hypoglossal nucleus, so let's say right here, the tongue will deviate to the direction opposite to where the lesion is taking place. So if the damage is above the hypoglossal nucleus in the upper motor neuron and the tongue deviates to the left, then you can suspect that there is a damage in the right hypoglossal nerve or in a damage in the primary motor cortex on the contralateral side of where the tongue deviates.